goals or whatever, just very blindly giving people, information because nobody knows a lot about it and it's no one's fault. It just is the nature of this area. It's kind of taboo and we don't know a lot about it, but we do now. So I thought it was a great opportunity for me to dive into something that was needed. And also I work with women. I'm also a Pilates instructor, certified Pilates instructor. I've been teaching since I was 23 years old. So over 10 years now. So I love like women, not that pelvic floor is just for the woman, it's for men too, but I am drawn to working with women. So I thought it couldn't be a better fit for me. So I then took courses out, after I graduated from PT school, I took a couple years worth of, on and off of courses to get my pelvic rehabilitation practitioner certification. So, and that's what brought me here.
Beautiful. Excellent. So let's talk about the pelvic floor, because when I talk with patients that come in and they have certain conditions that involve the pelvic floor and we start talking about it, I said, well, your pelvic floor is involved, and they give me the puppy dog look like, what are you talking about? Because I don't think a lot of folks realize that there's muscles on this pelvic floor that we use them all the time. They use them. They don't even realize they're using them. So if you can give us a little bit of anatomy and physiology about the pelvic floor.
Yes, absolutely. So, as Dr. He's like, they're muscles of your pelvis. There's a lot of them actually. They're very small and delicate, but they are extremely powerful and efficient. And they work for you, like he said, all day long for you. So they're the muscles that are, they encompass the bowl of the pelvis. So if your pelvis is like your hips, like if you have your hands on your hips, that's actually your iliac crest. But and then you have like your tailbone and your pubic bone. The muscles are attached to all those bony structures and kind of act as like a bowl, something that's like underneath those muscles and around. So inside that bowl, you have your pelvic organs. You have your bladder, your uterus in women, your prostate in men, your rectum, and the muscles work in conjunction with those organs. So anytime you have a bowel movement, your muscles are involved. Anytime you urinate, your muscles are involved. Anytime you have intercourse, I think that's pretty obvious, they're involved. So when you're the short and sweet is when you are, these muscles are going to have to contract, which is when they shorten and they are strong, and they have to be able to relax, which is lengthening, just like any other muscle in your body. So I really, everything to the bicep, because I think it's the most easy understood muscle in the body. So just as if like your bicep muscle, it's contracted, you're making the pot pie muscle, that's a strong contracted muscle. When the muscle's relaxed, it's not doing anything, it's lengthened. Yeah. So the pelvic floor works the same way. So when the muscles contract and shorten, that's when they're trying to support a function such as hold back urine. So when you're trying not to leak or not to go to the bathroom and you're running to the bathroom, those muscles are shortening and contracting to prevent that from happening. Likewise, if you want to have a bowel move or don't want to have a bowel movement or don't want to pass gas, I'm going to get real personal here because welcome to pelvic floor therapy. So those muscles are going to help. They're going to stop that passage of gas because they're going to contract around certain areas of that organ. So the other thing that they do in the opposite way is that when you want to actually go to the bathroom, they have to relax. They can't, if they are contracted and shortened, they're just going to fight what you're trying to do. The other thing that these muscles do are help with your breathing. So they actually, in fact, work with your diaphragm, which is your pelvic, which is your breathing muscle. And it works in conjunction. So they work like a piston. So as you breathe in, your diaphragm lowers to accommodate for the air, to make some space for the air. And your pelvic floor actually lowers, which actually means it's relaxing. And then when you breathe out, your breathing diaphragm will push out the air. So it will lift up, and your pelvic diaphragm will lift up. And that's all to basically regulate pressure in your abdomen. Well, actually your entire thorax, your entire, from from your voice box to your pelvic floor, they're trying to regulate the pressure in between those areas. So imagine how many breaths you take a day. Your pelvic floor is just doing this all day long for you, as well as those other functions every time you go to the bathroom and whatnot, right. And of course too, to boot.
And we can touch again on the importance of breath work. And breath work is extremely important. I mean, we talk about it with our IBS patients. We talk about it with our autoimmune patients. We talk about it with our musculoskeletal patients. Like, you can never go wrong doing breath work. And I don't think many people realize how important the pelvic floor is when it has to do in relation to breath work, right? They're just thinking, my pelvic floor, well, that's down here, breathing's up here, and right. What does that got to do with it? So that was a wonderful explanation. Mm-hmm. So we're talking about the pelvic floor, and we're saying, well, everybody gets how they injure their back. You know, they bend over, they pick something up, they injure their back, right? Mm-hmm. They get that. So how does one get a pelvic floor injury? Now, when I grew up, we used to have these sliding boards that they weren't made of plastic. It was made of this kind of like this stainless steel, and it would not even out. So you'd come off the sliding board and come right down on your coccyx.
Oh God, yes.
Coccygeal injury. And we've had people with slip and falls, and that gives us this pelvic floor injury because coccygeal injuries are so tough to deal with.
That's right.
Aside from a straightforward, I fell on my coccyx, and now we got a pelvic floor injury. Right. And in my practice, we see people with musculoskeletal from a motor vehicle accident. You get seatbelt injuries as well and all that. So we got that. Right. So that makes sense. It's a mechanical thing that happens. And now we have an injury. They might not realize that their gluteal injury is part of the pelvic floor, but it is. Yeah. But if we step away from an injury, how does one get that pelvic floor involved? How does that become involved in, dysfunction?
Right. So, right. Like, as you said, there are the most obvious where it's like a blunt injury, you broke your tailbone or, you just landed hard or something along that nature. And people can understand that, there's some tension down there now because the body's sore and healing. So when there's not like that abrupt injury to that area, some of the other things can be that can cause dysfunction are muscle tightness and muscle weakness. So the two extremes. So someone who has muscle tightness, people are like, well, I don't know if my muscles are tight, and I don't know why that would be if they were, because we can't see it to be like, okay, let's stretch that muscle. Some of the underlying reasons could be stress. So many people carry stress in their pelvic floor. It's actually been correlated in a lot of research to jaw and neck pain. So if you're noticing that you tighten up your jaw muscle, all these muscles in your jaw, and also in your shoulders, that you're likely carrying tension in your pelvic floor. So there's a really strong correlation between the two. So if you feel like you're getting stressed or anxious, and maybe you're just, going through a hard time and you end up being used to that state, your muscles are then they're being trained to just be tight, even long after your body's over that stressful period, it still might have just held on to that tightness, because when you have a tight hamstring, in the back of your thigh, it's tight, you can stretch it and something's telling you that it's tight. But the pelvic floor, nothing is really telling you that it's tight. Nothing obvious is telling you. So you probably just don't realize. But one of the things that you will tell you in a way is pain. So if you're having pain when you're urinating, when you're trying to, hold back urine, you feel like that urge to go to the bathroom all the time, it's really uncomfortable. If you have painful intercourse, those are all signs that there's been some dysfunction down there, and it's likely due to a tight pelvic floor. And there's different ways we say that. We say hypertonic, which just means it's like there's a lot of tone in there. or just, a tight pelvic floor. So, that's one. And then the other extreme is the weakness. So if your muscles have developed any weakness down there, and that can be from many reasons, a weakness can just, as we age, those muscles can lose the hormones that estrogen and testosterone, androgen hormones that will keep your muscles strong. We naturally lose them, which is okay, but you can combat that with strengthening, and sometimes people need some hormone adjustments and things. But some other ways that you can have a weak pelvic floor is by straining the pelvic floor. So this is a lot of like the younger populations, like, they're like, why would I have a weak pelvic floor? I'm only 20, but it's because like maybe their habits, like their bathroom habits and their exercise habits have led them to strain their pelvic floor a lot. So what that I mean by that is holding your breath while you have a bowel movement, or pushing to try to get a bowel movement out over time. Doing that as many times as you can think you do that over a lifetime can put strain on the pelvic floor, because your pelvic floor is supposed to be relaxed. There shouldn't be any effort, real effort involved. Same thing with like urinating. Like people will, like, we call it racehorse peeing, when you're just like, I need to go to the bathroom. So you just like force it out. You're like, I only got 30 seconds. We see this so common with like people with children, because you're like, I only have so much time. So
and teachers too.
And teachers, yes. Oh my gosh. And teachers, yes. And nurses. Yep. So yeah. And you'll see that people will start to strain because they're just rushed. And over time, over and over and over again, throughout your entire life, if you do this, it will start to weaken the pelvic floor. And then there's the obvious childbirth. So you're holding that weight on the pelvic floor as you're pregnant. And then when so that's a lot of strain on the pelvic floor. And then also when you go to deliver a baby, that's a lot of trauma on the pelvic floor too. So that can be an obvious one, but these are all things that are fixable. They're preventable if we're educated, and they're also fixable, if that makes sense.
So in my world, with a lot of patients that we see with irritable bowel syndrome, there's a lot of constipation. So there's a lot of pushing. And then we have those with IBS with diarrhea. So either way, holding in or going too much seems to cause a problem to the pelvic floor.
Right.
So, but very rarely would you get a referral from a gastroenterologist that says, hey, you should look at the pelvic floor, right? So I think that's something really important to consider. And have you dealt with patients that have ongoing GI discomfort and have pelvic floor dysfunction?
Oh, absolutely.
Okay. So what do you see? I mean, what do they share with you, and what do you see? And the question would be like, wait a second, if she's doing pelvic floor, what does an exam look like? So so there's gonna be two questions. So it's, hey, do you see this with your gut patients? And B, what does an exam look like?
Yes. So with those that are experiencing like constipation, diarrhea, chronic, constipation, diarrhea, and those can be like the IBS, the Crohn's, things like that. I'll often find a couple. Actually, there's two things that I can find, which is they can have a tight and weak muscle, or they can just have a weak muscle. So I've found that some people will end up developing a really tight muscle because like you had said, some people will be holding back a lot, like with the diarrhea, patients with the urgency, they will be holding back a lot. So their muscles are just constantly tightening and fighting for them. So they don't really get that chance to relax. And if they're not getting that chance to relax, they're not going to be able to fully contract and get strong because they're just stuck. So back to like the bicep, like if your bicep muscle could only do this from here to here, it's never going to get truly strong. It will get bulky, but it's not. I'm so sorry, my dog. Frank.
The dog's fine.
So
I thought maybe your stomach was growling. I'm like, wow. I mean,
yeah, I know. He's just, oh my goodness. I am so sorry.
Where is he?
He's not usually this bad.
Have him come to the camera.
Of course. What was that?
Have him come to the camera.
Yes, I know you should. Well, he just ran away. He's probably going to bark at a closer area to the person. So, okay. So a tight muscle. So they can develop a tight muscle because they've been overworked. It's basically an overactive pelvic floor. So it's just working too much. It's an overdrive. But what happens is now it's not strong because it ended up not being able to go through its full range of motion to produce a really strong contraction and then hence get stronger. So if it's just kind of stuck, like it's doing this over and over again, it's not a strong muscle because when it wants to actually work, it ends up only being able to do this. And it's like, that's just not strong. So that is a common, what I'll typically see. And also I'll just see a plain old weak muscle, which just means it can really not really get there. It can relax, but it can't really produce that strong contraction to hold back whatever it's got to, to do its proper function. So, but to answer your question about what an exam looks like. So clearly you can't see these muscles from the outside. So I have to be able to go inside. So what I usually do is it's just a really simple, painless, most of the time for most people, painless exam, which involves gloves and one finger. So
okay.
I'll go in and assess very gently and feels very non-invasive, at least what I've been told. I hope my patients tell me if it doesn't feel that way, please. If it doesn't feel that way, for future people that see pelvic floor therapists, let them know. But it's usually a very easy exam. So I'll go in and I'll feel the muscle integrity. So I just want to see if the muscles feel that, if they feel like there's not a lot of tone, like it's kind of like, and I'll usually see this with people as you get older because your muscles have lost those hormones that really bulk up and keep the muscles strong and the blood supply, there. So I'll feel kind of like a squishy, but not really pliable muscle. And then sometimes I'll feel the opposite, which is like really tone. And it's like pushing on a trampoline, like there's just no give. And there I know that that's a hypertonic, a tight pelvic floor. So those are the two things I check for immediately. And then also your strength. So I want to see if you can be relaxed, like completely, if your muscles know how to relax and if they know how to contract. So for pelvic floor in the pelvic floor world, that's a Kegel. So if you've heard the Kegel, it's the pelvic floor contraction. So I'm testing your strength of your Kegel, which is the ability for your pelvic floor to squeeze and pull up. So it's two parts, a squeeze and a pull up. A lot of women don't know that because it's like people just, this word's been thrown around a lot and no one's really explained or tested and whatnot. So most women do this wrong. And that's actually extremely common and normal. So it's like, I think it's something like 8 or 9 out of 10 women do a Kegel wrong. But that's what I'm testing for. And I'm also testing for prolapse, and that's something where like the organ will descend and, and that can happen for numerous reasons too. So those are the major things. There's other things I'll look for too, just pain. See if if I'm pushing on muscles and there's pain, then I know that that's not a healthy muscle because, muscles, you should be able to push all over your body and not be like, ow, ow.
Right.
So that's kind of what I'm assessing for. Yep.
Okay. So let's talk about some of the common things that we'll see. PCOS, we'll see interstitial cystitis. Those are two of the common things I'm sure that you see. Can you talk about those two types of presentations?
Right. Absolutely. So interstitial cystitis, that's there's a kind of another broad term I use for that, which is an overactive bladder typically. So usually I see women and men that feel the urge to go to the bathroom all the time. And it's an urge that's painful. And oftentimes they'll go so frequently and they get no relief. They're like, I feel like I have to go to the bathroom all the time. I go 15 to 20 times a day, waking hours, and I still feel like I have to go. Like, I'm not drinking anymore because I feel like if I drink, it's going to make me want to go more, drink water or whatnot. So that's the typical presentation, and it's really uncomfortable, so like they feel like right near their bladder, right above the pubic bone, they get that discomfort. For me, my initial response is always, my initial thought when they're, when I hear those descriptors or symptoms is like, ooh, I think they're going to have a tight pelvic floor. I think their pelvic floor is overactive, so it's not relaxing for them to have a complete emptying of their bladder. So, that's one thing, I try to get people to relax that pelvic floor if that's truly their problem. Sometimes that's not. So, that's where the exam comes in. But, you want that person, if that's what their problem is, to really relax the pelvic floor. So then when you do go to the bathroom, you're completely emptying, because if you're tightening your pelvic floor, you're basically kinking the hose. And if you're kinking the hose of the urethra, not everything is going to come out, and it's going to feel stuck, like something's still in there. The other thing is people have trained their brain to, or trained their bladder, I should say, to control their brain. So the bladder is a highly sensitive organ. It is the only organ besides the rectum that will talk to you. Like, it literally tells you when it wants to do something. So that's a very, it's such a strong correlation between your brain and your bladder that you can train it in a positive way, or you could train it in a negative way. So, I find that because people that have the interstitial cystitis have trained their bladder in the negative way. So likely anytime they get any little urge, they go to the bathroom. Well, here, your bladder can hold about 3 cups of water or fluid. So if you just had a cup, doesn't mean you have to go, sometimes you will, but not every time. Or, so sometimes I tell people you think of your bladder, the urges for 3 urges. So you should have 3 urges. You should have an urge when it's like a third of the way full. And that urge is like, oh, something's in there anyway, moving on with my life. The second urge is like, okay, I'm probably gonna have to go to the bathroom soon. Like, I'll probably go in once my meeting's over or whatever, you can hold it, but you're gonna go. Then there's that third urge, which is like the bladder's full, you're running to the bathroom, but there's those 3 urges. What I find when people have that interstitial cystitis is that they're listening to that first urge all the time. And they're acting on that first urge. So they're going to go to the bathroom every time they feel like there's a little something in there. And that's going to train the bladder as if it's the second or the third urge. So the bladder now is going to say to the brain, oh, every time it's only, a third full, it's going to act as if it is halfway or completely full, because you have treated it like it needs to go, so that's kind of where that happens. And then now it has literally tricked your brain into thinking that it is it's urgent. I got to go to the bathroom. But in reality, if you start to be the boss of your bladder, if you start to train your bladder and say, no, I'm going to distract myself, I'm not going to go to the bathroom, I know I already went an hour ago, or in some people's cases, I know I already went 10 minutes ago, I don't need to go, then you can start to retrain it. It's like baby steps. And then eventually, you will start to see, like, you don't have as strong of an urge anymore. It's maybe every 2 hours that you have to go, or maybe every 3 hours you have to go, not every 20 minutes, which is what I see with some of my patients. So,
Gotcha.
Yeah.
Okay. And in Polycystic Ovarian Syndrome, PCOS.
Oh, I'm sorry. What was that?
And PCOS.
Oh, yes. Yes. So PCOS, what I see typically with PCOS is a lot of abdominal discomfort. And I think that you can probably speak more to this than I can, but what I do, what I typically see is some tightness or hypertonicity of the pelvic floor, like an overactive pelvic floor also, but usually it's related to discomfort in in like the abdomen and like the pelvic organs because of like the nature of what is going on in there and the cysts and things. It's like just uncomfortable. And then all the muscles surrounding are going to start to guard and protect. So I feel like people's abdomens are usually like on fire, and so is their pelvic floor. They're just oof. But because like I personally, and I know that like it's really not well understood like why this is happening. I know that it's usually a hormone increase in androgens. So if, and obviously I don't fix that, but what I can do is treat the symptoms, which is the tightness of the pelvic floor and the abdominal discomfort. And I usually treat that with a lot of relaxation techniques and breathing to let go of some of those muscles, just to release and relax, retrain them. And then the other thing, which is what I was thinking that you could probably speak more to, is the dieting, because in my opinion, I've seen people that go for the anti-inflammatory foods do a lot better, because like there's something in there that's just, it's reacting, and you got to stay away from the foods that aren't going to help that. Like, there's like, obviously sugar's the big one, and carbohydrates, and, the bad carbohydrates, like, white breads and stuff like that. But definitely sugar. I think like there's cysts like feed off of that, the sugar and the carb, the simple carbs. So I tell people like, if I'm not a nutritionist by any means. And, I've not practiced functional medicine, but I do know that that's not good. Right. If I can say anything, that's not good. And then
and it contributes to that whole systemic inflammation thing. So, you're right. You have to come off the sugar, and nobody likes it. I mean,
no. I know.
This is the way it is. It's interesting how you talk about the pelvic floor always being, tight, and people don't recognize that it's tight. And it's just like, well, it's just their norm, right? It's like, it's normal to have constipation. It's normal to have diarrhea. It's normal to, have some burning when urinating. They just think just because something happens all the time doesn't mean that it's normal.
Right.
A lot of times that we'll see with the neck and upper quarter patient, we see their shoulders up like this, and they're like, you're like, put him down. And they're like, what? Like, put him down. They put him down. They're like, what is that up? So you can imagine when they're stressed, that pelvic floor is also in such a level of contraction, hypertonicity, and they're not relaxing, and they get all these complaints, not realizing that it has to do with the muscles on the pelvic floor.
Mm-hmm.
So before we jump into like things that you can do for it, I want to talk about the relationship of Pilates and movement and pelvic floor. Before we jump in that, we got to talk about the guys. I mean,
can't leave them out.
We're always not the sharpest tool in the shed. We don't like to take, we don't like to take care of ourselves all the time. We think we can muscle through everything. How do you address, a guy with a pelvic floor problem? And a lot of times they think, well, erectile dysfunction, well, I'm getting older, or it's low T, or I just need some Viagra and Cialis, when they don't realize it definitely could be the pelvic floor.
Yes.
So how do you address that issue? What can we tell the guys to get smart,
Right. Seek help. It doesn't make you less of a man.
Right.
Because you guys are like, I can fix.
We can fix anything. We just need to lift heavy things.
Right. Exactly. So interestingly enough, the pelvic floor can absolutely pelvic floor work can help with like erectile dysfunction, things like that. I've had men that have a couple things they've come to me for is increased urination, pain when urinating, and another common one would be erectile dysfunction. And post prostatectomies, because you've had some you've been now trauma to that area surgically, so the muscles have been compromised. So I'll see that too. But men typically have tight pelvic floors, though. So and for whatever reason, it's like really difficult for men to connect to that area. Guys are like, I don't think I have a pelvic floor. I was like, oh wait, no. You do.
They don't understand. It doesn't work without the pelvic floor.
That's right. Exactly. I'm like, what did you think was helping you down there?
It's just
They're like,
magic,
oh,
that's all.
okay. So the muscles are the same, there's the exact, some of them look a little differently, but they're all there, the same as a woman, So I typically with men, it's like I get them to connect to that area first and foremost. So there's two ways that I can do, two ways I try. One is you trying to through just conscious like relaxation for the whole body, and then getting them to feel what it is to contract the muscle and then feel what it's like to let go. Because a lot of times you don't know how to relax unless you know what it's like to tighten. If you tighten it, then you're like, oh, okay, that's that muscle. Okay, I get that. And then when you release it, you're like, oh, that's what it's supposed to feel like, or whatever. The other thing I do is I put people on a little biofeedback machine. It's like this tiny little machine. And I have these little sticky electrode pads and I put them really close to the pelvic floor externally. So nothing's inside. So basically I put them really close to the butthole. Sorry. So that will pick up the electrical contractility of the muscle. So, and then you, like the person can actually see what their pelvic floor is doing as far as, is it relaxed? Is it contract? Is it tight and holding on to tension? Because it will give us a little number. And I explain that, what those numbers mean. And it's really easy, but so that can help people because they're like, oh, wait, okay, well, if I do this, whatever that is in their head, they're like, whatever cue it may be, like imagery is usually a big one to get to connect to those muscles. They'd be like, oh, if I do that, that relaxes my muscles. If I think like that, or if I take a breath like that or whatnot. If I to contract my muscles, I think about this analogy, whatever that may be. So you can really start to train and see what works because it's so hard to connect down there, like it's not a hamstring or a bicep that most people understand. So it takes a little bit of time. And that's why pelvic floor physical therapists are really important, and they can teach you just so many things, like it's just, you just needed to know and you need to practice. So men, I just get you guys to, for whatever's going on, I try to get you to just tune into that area and so then the rest is on you. You don't have to see me forever. It's just, I give you the tools and you just, yeah. But for erectile dysfunction, just a little side note, a lot of times you need to be able to do your Kegels too, which is very, very similar to a female Kegel. The pelvic floor just kind of lifts up. So everything underneath is just lifting up. That brings blood flow to the area, and that gets the tissues nice and healthy. And when blood flows to the area, things work better. So that's really where that ultimately comes from for erectile dysfunction. So
Gotcha. So aside from doing Kegels, let's talk a little bit about some of the treatments. So home treatments, aside from doing the Kegel exercises, what else can somebody do to help them? And how do you distinguish, like in my world, there are some muscles we need to stretch, some muscles we need to strengthen, some things we just need to stabilize. So
yeah, right.
There's got to be more than just a Kegel exercise, right? So
Absolutely.
what else is there for us to do at home?
Right. So if you're weak, you have a true weakness, it's not because you're tight, true weakness. The other muscle groups that help support the pelvic floor are your deep abdominal muscles, which is your transverse abdominis. That's your deepest muscle that wraps around your body like a corset. So supports the inside of you and it supports your back, your spine. Very important muscle. So number one, that's the one I'd like to train, deep abdominal muscle, your transverse. So that's not doing a bunch of crunches. It's a little bit more mindful than that. Then there's the back muscles, your deep spinal muscles, your multifidi, particularly a very, very deep spinal muscle, supports the pelvic floor also. And then your glutes, the butt. It's a very helpful. They are a massive muscle group in your body, the biggest muscle group in your body. So they want to work for you. They do so much for you. So help, strengthening the glutes will support your pelvic floor. That's if there's a true weakness. And I mean, that's probably good for anybody, honestly, even if you had some tightness to strengthen some of those things. Mm-hmm. But the other part is stretching. Like you said, there's certain muscles you want to stretch, some you want to strengthen. Stretching the muscles that attach to your pelvis that are most important are your thighs. So the back of your thighs, which is your hamstrings, your inner thighs, which are your adductors, and your quadriceps, which are the front of your thigh. So those three muscle groups, super important to stretch if you have pelvic floor tightness. The other is your hip flexor. So your psoas muscle, it's your hip flexor muscle. It's right in front of the hip. Usually it's tight on everybody, to be honest. That one, definitely stretch. And then just regular like spinal movement, just getting your spine to be like more flexible will help everything just kind of like work better and relax. So that's the short and sweet of that.
But then that leads us to Pilates, your other love, right? So you can't go wrong with proper instructed Pilates. I think you can go wrong with like, hey, got something off the internet, that's where, it goes awry really fast. So let's talk a little bit about how Pilates, just from inside out, top bottom, is extremely helpful.
Oh, yes. So thank you. That's definitely that's my other love. So that transverse abdominis muscle I mentioned, that is one of the goals of Pilates, is to strengthen that deep abdominal muscle. So the exercises that you do in Pilates, they seem really weird to most people because we're typically used to just doing like big movement exercises. But Pilates works your deep core muscles. So your deep abdominal, your transverse muscle, your deep spinal back muscles, and your glutes, that's your core, so like in Pilates we work like your core, we call it your powerhouse, but side note, but it's your core. So we're working in Pilates, you're working those deep, they're not tiny action muscles, but they're the deep muscles. So that's why some of the exercises aren't like your typical, like I just did a lot of crunches and planks. Well, planks are in Pilates, but it's not like your typical, like, you see every day for strong abs, because they're trying to really isolate like the deep core muscles. So the exercises don't feel natural at first, for that reason. But then you get used to it and you're like, oh, this is so cool, because you just feel so much stronger.
You feel a difference.
Yeah. The other thing that Pilates does is helps with your posture. So posture plays such an important role in so many things. I'm sure people can understand that, but especially in the pelvic floor. So like posture, having your, just real quickly, you want to make sure that your ears are over your shoulders are over your ribs are over your hips. So I always demonstrate what like the two extremes are usually for people. It's like usually our back is arched and and our shoulders are too back, or our heads jutted forward, or it's like we're rounded and we're looking like we're at a computer all day. So you want to be in the middle. You want like your chin kind of slightly back, shoulders slightly back, none of that, and your hips just kind of right underneath your ribs. So posture is so important because, as I was talking about with the pelvic floor and your breath or your breathing, which I know we'll probably maybe touch on later, I'm not sure, but you want to make sure that you're stacked properly, because if your ribs are more forward than your pelvis, then they're not stacked, so now they're not going to be able to work efficiently. The body is very mechanical, like it's just like a little machine. So things have to kind of line up for it to work properly. It will do its best. If they're not, it will try very hard to still work, but it works better if you're more aligned. So, diaphragm is here, pelvic floor, they work like this. So you want them stacked. So posture is so good, and Pilates works all the postural muscles. So you'll feel taller, you'll feel more like, your shoulders just naturally go back. You don't have to force them back because you've done these exercises to kind of strengthen those muscles back there. So you don't really have to do the work consciously once those muscles are just stronger to kind of put you there. So that's kind of that.
Yeah, I think Pilates really contributes to an individual's resiliency and adaptation and the ability to handle the demands in the day.
Yeah.
So if you're moving well and you're moving with, fluidity, and, you're asked your body to do something, you respond well as opposed to reacting.
Absolutely.
And I
Yes.
think that's what one of the greatest benefits that Pilates offers. I don't think people realize it because maybe they'll get into it because there was an injury. Pilates is wonderful for rehabilitation.
Yeah.
They get into it because we're going to quote unquote get in shape.
Mhm.
But it really gives you this overall mind body connection, this brain body connection that
Mhm.
allows you for that resiliency. It's
Yes.
one of the many reasons I like Pilates. I think it does wonders. So
Yes.
we talked about, you know, the things that can create the pelvic floor presentation, from an overactive bladder to you know, injury to interstitial cystitis, PCOS, painful intercourse, musculoskeletal injury to it, the GI related dysfunctions from IBS to SIBO, anything that's causing our pelvic floor to work overtime or work too hard. So let's touch base on, you know, food. I mean, I know PCOS, we touch base on, you know, let's cut out the sugar. That's a given for almost anything, you know, let's just cut out the sugar. Are there any other type of nutrition recommendations that you recommend?
Yeah. So, one, leafy greens. So, I'm like, if you can add in one thing, and, so you don't overwhelm yourself with like, I got to take out this and I got to add in all these, healthy things, um, for just general pelvic health. It's leafy greens. They regulate hormone. They've been proven to regulate hormones. So especially like too much estrogen in the body, which like has been linked to like endometriosis. Too many androgens has been linked to PCOS. So it's like just leafy greens have been said to regulate hormones. So leafy greens. I also fiber. I mean, people are probably like, oh God, like stop with this fiber stuff, but it's so important. Fiber, I try to tell people there's two types. There's insoluble and soluble. You want both. You want to aim for 25 grams. So insoluble, just to kind of break these down pretty simply for you, like, so insoluble fiber, I think of like the harder foods that they're going to kind of the healthier harder foods like the broccoli and like some things that have like the skins on them like apples that they're like very fibrous because it's going to like kind of clean out your intestines. It's kind of like sweeping the stuff out of your intestines. Then there's the soluble, which they're like the softer foods, and they kind of give your bowel movement like a kind of like easier slide. They give it some form. They give it, it's smoother. So it's not as hard for you to get rid of it. It just kind of slides on out. So that's kind of like your oatmeal, like you think about like the way that looks, even like that's helpful. It's just easy on the intestines. So you kind of want, like, I tell people, you just want that balance. Like you want to eat like the fiber that's like easy on your gut, which is like your oatmeal and your flax seeds and chia seeds. Those are things that are really good in fiber that help things just like move along easily. And then you have like, your insoluble, which is really going to help like kind of like scrape out. It sounds really aggressive, but cleans it out. So those two things. And then water. Don't kill me, people, but water. Here I am saying it. You're going to see it everywhere. You got to drink water because it's for so many different reasons.
But I don't like the taste of water.
I know. I'm like, oh gosh, gonna have to hear this. You can put a little something in there. You can put some fruit in there. You try to give it some flavor.
That's the common one here, but I don't like the taste of water. I'm like, well, what does water taste like? And they're like, I don't like.
Exactly. It's like, it's a good point. I think about that. You're right. Well, there is no taste. You not like the taste.
Okay. I'm like, all right. So, that's where we try to get them to just add it in their day somehow. I agree with you. All right. So as we're starting to wrap up, I want to end with something really important, and that's about the importance of breath work. So let's talk about breath work. What can you share with us about that importance? Because there's more and more research and more papers that are coming out talking about the importance of breath. And in my practice, not breathing, they're not diaphragmatic breathing. They're coming all scalenes. Everything's tight. They've got the headache that comes around here. Their gut is clenched. And it means they can't even relax enough to even, go to the bathroom. So let's talk about breath work.
Oh, yes. So breathing, foundational, the foundational movement of our body. You know, we are born breathing. It's how, you know, if we don't breathe, we're not living. It is so important. So, so what I try to explain to my patients is, when your body is in a state of stress and tension, so if there's like muscle tightness and, you know, guarding going on and just discomfort, breath is going to help turn off that system that tells your body to tighten and be in that fight or flight mode. If you breathe diaphragmatically, your central nervous system will turn on to a different setting. It will turn on to the parasympathetic system, which is like your rest, digest, breathe, all these, you know, things that you need to do, healthy, you know, like a healthy, relaxed state. So when there's been studies for this, you know, so it's real that people, if you start to breathe into your stomach and your rib cage, as opposed to your, or I should say your lower rib cage, as opposed to like your chest and your upper rib cage, you'll start to feel more relaxed. Like your body is going to start to let go of that tension, and your mind starts to relax too. Because it's physiological. It's just like the way your body responds to this type of breathing. It just is what it is. So, teaching people how to control their breath so that they can control their muscles and relax. So if you are in a tense state, you're likely chest breathing. You're likely breathing from here. And like you said, all these neck muscles, the shoulder, everything, your belly, everything is tight. And there's no air to go down into the stomach. It's just got trapped here. So that's going to actually make the problem worse. So because you're chest breathing, the body then thinks it's in the fight or flight mode, because it's like, we're just creatures, you know, if you think back, you know, hundreds of years ago, like the fight or flight response, like, you know, you're running from an animal that's going to kill you. You're not going to be breathing in your stomach. You're not going to be relaxing and breathing in your stomach. You're going to be, you're going to be in here. So when you breathe in there, those old habits from hundreds of years ago, it's training your body to be in stress mode. So trying to get your breath to go into your stomach and into your lower rib cage. So like expanding your lower rib cage and expanding your belly, that like 360 kind of feeling is going to turn on that relaxed state, that rest and digest, the relax, which is where our body should be like a majority of the time, you know,
not.
Right. But not in this world,
Right.
Day and age. We don't feel like we can get there because it's so stressful, but yeah. So that's what I have to say. One of the things I have to say about that. What's your take?
So, and because of our current state of affairs, this is why breath work is even more important than ever before, right? So we use a lot of box breathing at the office. You know, I talk about box breathing. We talk about diaphragmatic breathing. We talk about the gut-brain relationship, the vagus nerve.
Yes.
You know,
Yeah.
now more than ever, that whole sympathetic, parasympathetic, I mean, there's sympathetic overdrive everywhere now.
Oh,
You know,
yeah.
and breathing is important, and movement like Pilates is important, and drinking your water is important. And today, like we talked about, you know, I don't think a lot of people realize how important the pelvic floor is. You know, so, you know, this is really great. So if you can share with us, how can we contact you? So if you can give us that, and if you can give us your top pelvic floor tip, that would be great.
Yeah.
How do we contact you, and your top pelvic floor tip?
Okay. So you can reach me. I am on Instagram, social media, Facebook too. It's Village Physical Therapy and Wellness. So Village Physical Therapy and Wellness. And if you have any questions and want to email me directly, you can email me at it's villagetherapy99@gmail.com. So villagetherapy99@gmail. So my biggest tip for pelvic health. Okay. So very basic, so basic, but it is learn how to connect to your pelvic floor and relax it and contract it. Learn those both how to do that, just as if you were trying to strengthen any other muscle in your body or stretch any other muscle in your body. Try to do that the pelvic floor. Don't leave the pelvic floor out. It's so important for you. So try to tune into that area and learn ways to relax it, let go, and contract it and strengthen it. So if you need help with that, just find a physical therapist, a pelvic health therapist.
Find a pelvic floor physical therapist.
That's right. I was gonna say, I'm like, don't go to any other therapist.
So that leads me to another question, because I'm sure we go on. How does somebody find, I mean, if they're not in this area, how do we find a pelvic floor physical therapist? Is there a site they can go to that they can go for somebody who's certified?
Yes. I want to say it's called APTA .org, and that is a website that all physical therapists are listed on, but there's a little spot where I'm pretty sure it says women's health or they should have changed it by now, because back in the day it was just a women's health physical therapist. Now we're like, no, like men have pelvic floors too, and they need to so I think they changed it to pelvic health therapist. But if you go on the APTA.org website, you should be able to search, like they'll have like a link of like search that provider or whatnot. What is another good one? Facebook, believe it or not, if you just look for under groups and look for pelvic health PTs, they're all, and you can just write a little message. Hey, any PTs near this town? We are pelvic health PTs near this place, and people will respond, and a lot of us are on there and stuff, and we know people, and we can link you up and stuff too. So
right.
Those are the two things I can think of right off the top of my head. There's also the Herman and Wallace Institute website where you can go on, and so that's where I'm certified through Herman and Wallace, I think. Yeah.
Okay. Great. And the other question that, patients will always ask is, is this usually covered under my insurance? So is it usually insurance coverage just under PT, I'm assuming?
Yes. I have found that because it's a specialty, it will be, some places will charge as a specialty. So like if you're, I'm not 100% sure if this is every insurance or every place, but I don't be shocked if it's a different fee for maybe a different copay or something,
like a higher copay.
Higher copay than your normal PT would be. Yeah. Because as far as billing, we bill exactly the same as if we were a, sports medicine physical therapist. We have the exact same billing and prices. But for some reason, I feel like insurance sometimes treats us as a pelvic health or a specialty, and they might charge you more on your copay.
Excellent. Yeah. All right. Very cool. Well, thank you so much for today. Believe it or not, that was an hour.
Oh, wow.
We shared a lot of great information. And what I'm going to do is I'm going to end this right now. Just hang out with me for 1 second.
Sure.